Hi, everyone. Thanks for coming for this talk. My name is Flávio Oliveira Pires. I'm associate professor at the University of São Paulo in São Paulo, Brazil. And I came here today to talk a little bit about placebos. So for me, it's a big pleasure to do this during this American College of Sports Medicine Congress. And as you can see by the title of this talk, the reward for placebos, mechanisms underpinning placebo-induced effects on motor performance. I will present some evidence that the reward system is related to some placebo results in motor performance scenarios. So hopefully, at the end of this talk, I will be able to convince you that the reward system can be used to explain placebo results in exercise scenarios. And to do this, we have a program that we will follow during this presentation. So I recommend you follow too. So you start with a short introduction, and then you move to other topics. So we will cover some psychological triggers of the placebo effect before going to neurochemical routes of the reward system involved in placebo results, in placebo effects. Then I'm going to show you some perspectives for placebo studies in motor performance scenarios, given that most evidence came from multidisciplinary fields, not involving exercise manipulations, or at least exercise perspectives. And then I will show you some sex and nocebo influence, especially for future studies investigating mechanisms. And then we will finish this presentation by making some considerations and providing some take-home messages. So let's go to the introduction. But actually, before, let me share some a fun story about placebo. I always say that every researcher has a specific reason to study a specific topic. So for me, it's not different, but I have a funny story that pushed me to study placebo. It started about 30 years ago when I was finishing my postdoc. And that time, I had a master's student, Fabiano. Fabiano is my friend. And he used to run in a competitive form, in a competitive way. He used to run against his father. So just a detail, his father is about 23 years older than Fabiano. And he came to me to complain about his father that time, because he used to lose to his father during the running. So he came to me and he started complaining about his father, saying that, Flavio, I don't know why, but I cannot beat my daddy in the run. So that time I was studying caffeine and caffeine effects, more specifically, caffeine effects on motor performance. And I was using as a control a placebo perceived as caffeine design. So instead of using a traditional clinical trial in which you have 50% chance of receiving the active substance, caffeine, and 50% chance of receiving placebo, but you are not aware each one you're gonna receive. So a placebo perceived as caffeine design means that I manipulate the participant's expectation. So I induce the participants to believe they would receive caffeine in all conditions, even when receiving placebo. So that time when Fabiano came to me. I was manipulating placebos, inert pill. And I said, Fabiano, listen to me. You must use this pill. This is caffeine. It's a powerful ergogenic aid. And I'm sure you'll be able to beat your daddy in the next running. And the funniest part of this story was that a few days later, Fabiano came back to me and said, Flavio, it's incredible. I beat my daddy, and I can't remember the last time that I beat my daddy. So I beat my daddy. It's incredible. It's a powerful. So this funny history. So this is Fabiano, of course, celebrating his victory. So this funny story pushed me to study placebos. So I started studying placebos to better understand why placebo can improve performance. So last year, we published a paper, a review paper, suggesting that perhaps the reward system can be used to explain some placebo results on motor performance scenarios. So the opening paragraph was indeed imagined during that time. So Fabiano actually had a very important participation in creating the opening paragraph of this review paper, and I saved this story in my mind. So the opening paragraph is like this: imagine you are an athlete willing to break your record. Then imagine that your coach tells you there is a pill ready to improve your performance exercise while relieving exercise-induced depressive sensations such as pain and fatigue. But your coach is a reputed sports professional and gives a verbal suggestion that this ergogenic aid is powerful. So it's me. So the psychological clues of this scenario, such as the trust in your coach and the social learning regarding the ergogenic aids, make you believe in a positive performance outcome as a reward for ingested the pill. So this is Fabiano. Thus, after getting the pill, you perform the trial, experience relief in exercise-induced aversive sensations, and do the best performance ever. However, you got a pharmacological inert pill, and you have just experienced the so-called placebo effect. But you are not surprised, were you? So this is Fabiano. We published this review paper last year, suggesting that if you use some evidence from multidisciplinary fields, we can suggest the reward system playing an important role in placebo effects in motor performance too. But before going to evidence from multidisciplinary fields, let me separate some concepts just to make clear we are going on the same track. Placebo is an inert substance. So placebo is a substance or treatment which is designed to have no therapeutic value, such as inert tablets, injections or inert injections, shunt surgery, and etc. But the placebo effect is an effect triggered by placebo. So the placebo effect can be defined as an improvement in a specific outcome, usually induced by conditioning or expectation of a potential benefit in receiving a given treatment or intervention. So it's important to separate placebo, in other words, the intervention, from placebo effect. Just because this topic is full of tricky issues, you know? So if you go to multidisciplinary fields, you find that some neurotransmitters are related to a change in expectation. So dopamine, opioid, and glutamate, all of them are related to a change in expectation. And these three neurotransmitters play an important role over similar brain areas related to placebos. So this evidence came from other fields, different from exercise scenarios. So studies using or studying placebo effects in depression, in Parkinson's, and pain paradigms have shown that those neurotransmitters are related to placebo in those scenarios, those clinic scenarios. And if you use this evidence to build it up a model for exercise scenarios, it's important too, because exercise perspectives can be used to better understand why some pharmacological interventions might be more powerful than others. So, understanding placebo effects in exercise performance scenarios, it's important to better understand clinical interventions too. Um, for example, when we use exercise as a treatment, in a specific health problem. And it's also important to understand nutritional supplement effects. Why some nutritional supplements may have um, um, more effects or powerful effect more than others, inducing increased motor performance. So let's see how it works in exercise scenario perspective. So before going to show some neurochemical roles of the reward system that can be potentially involved in placebo effects in motor performance scenarios, let's separate some psychological concepts. Um, let me show you the psychological triggers of the placebo. In an exercise perspective, most placebo effect come from expectation, but expectation is a different process from conditioning. Although conditioning can change expectation, expectation is a conscious process. So expectation is the conscious process related to the belief that the future you follow the premises. So it's influenced by prior experiences and social learning. So basically, you have different forms to change expectation. And conditioning process is a different way to change expectation. But we can have a change expectation by using verbal suggestion or social learning too. Conditioning is is more unconscious. Conditioning is a conditioned response following a neutral stimulus. So the repeated association between neutral stimulus and unconditioned treatment induces a conditioning response. So here we are talking about the Pavlovian effect. So as you have a neutral stimulus associated with a specific response, so the result can be a conditioned response. So it's more unconscious. So conditioning is a way to change expectation, but we have other ways to change expectation. As I said, verbal suggestion. And why it's important to separate these concepts? Because some placebo effects are more evident when using a specific kind of change in expectation. So if you are talking about placebo or nocebo, we will see in the next slides that depending on the way that you change expectation, you can potentiate the placebo effect. So we'll talk a little bit more in the next slides about expectation induced by conditioning and induced by verbal suggestion. So now we are able to go to neurochemical roads of the reward system that can be involved in placebo responses in exercise scenarios. When you have changes in expectation, we have a change in how we can imagine the future. Because when you have expectation, what is the form, the way to represent expectations in your minds? So we represent expectations in your mind by using different forms, such as imagery form, semantic form, and symbolic forms. So those forms are representation of the expectation about the future. And when we have a change in expectation using these different forms, we increase the release of some neurotransmitters, as I said you before, dopamine, opioid, and glutamate. So those neurotransmitters are as such a neural signature that is changed, that is used when we have a change in expectation about the future. And the result of increasing the release of dopamine, opioid, and glutamate over some brain areas is an increased brain activation that is associated with a wanted or aversive behavior. So when we create expectations about the future, the process that we make these expectations, that we convert these expectations in behavior is using some different forms which are associated with increased release in some neurotransmitters. So this is the process that we convert expectations and behavior. So it's important to understand it, to understand this process clearly, because when we have a wanted behavior, it means placebo. So this is the process used by placebo manipulation. So we change the expectation, the participants' expectation about the future. So they use different forms to represent this expectation, this changed expectation. So as a result, we see an increased release in neurotransmitters over different brain areas, which are associated with a changed behavior, a wanted behavior in terms of placebo, or aversive behavior if you are talking about nocebo effects. So this is the road that we can use also to understand placebo effects in motor performance. This road is called the reward system road, because when we change expectation, we increase the release of those neurotransmitters, and those neurotransmitters change the activation in specific brain areas that compose the reward system or the reward circuit. So the brainstem, the nucleus accumbens, the ventral tegmental area, substantia nigra, striatum, but not only the subcortical areas, but also cortical areas So this big part of the frontal cortex, so the orbitofrontal cortex, prefrontal cortex, so the cingulate cortex anterior or posterior, supplementary motor area or primary motor cortex. So all of them compose the reward circuit. But if you take a look closer, you see that those areas are also involved in motor control and motor command. So the same circuit, the same areas that play a role in reward response play a role also in motor command and motor control response. And if you have an increased neurotransmitter release, it means that we have a higher action potential, so an increased synapses. And the result of releasing more neurotransmitters in a specific neural tissue is an increased activation of, that tissue. So if we increase the neurotransmitter release in some brain areas, it means that we have increased brain activation. And if those areas are involved with motor control and motor performance, so probably here we have a mechanistic way to explain why placebo that changes expectation can also induce increased motor performance. So this is the model that we've been suggesting since last year when we published the review paper. We are suggesting that as our placebo manipulation changes expectation, we have a higher release of some neurotransmitters, dopamine, opioid, and glutamate, uh, so the increased expectation, the change expectation using those symbolic imagery forms increase the release in some neurotransmitters, and this release in some neurotransmitters increased the activation over important brain areas connected to motor performance and motor control. So orbitofrontal cortex, prefrontal cortex, supplementary motor area, primary motor cortex, anterior cingulate cortex, thalamus, amygdala. All these areas are involved with motor control and motor performance. But we have also evidence that placebo change the excitability of the spinal cord. So it's important to highlight here that spinal cord has an important function, play an important role in motor control and motor performance. So our suggestion is that the same areas that play a role in reward response play a role in motor control and motor performance too. So let me show you some evidence that we have different reward brain areas involved in motor performance scenarios when using placebos. So let me show you some perspectives for placebo studies and motor performance scenarios. Here, a few years ago, we published a paper about caffeine effects on motor performance. But that time we used a placebo perceived as caffeine as a control. So as I said, instead of using a traditional clinical trial in which the participant is aware that that they have 50% chance of receiving the active substance or 50% chance of receiving the placebo. We induce the participants' expectation, making them to believe that they would receive caffeine in all conditions, even when ingesting placebo. So we submit those participants to a VO2 max test while measuring some cerebral response. So we measured the cerebral oxygenation over the prefrontal cortex by FNIRS. And we measured also muscle activation by EMG during 3 conditions: the baseline, without intervention, after caffeine ingestion, and after placebo ingestion, but placebo perceived as caffeine. And what we found was increased exercise performance in both caffeine and placebo. So not only caffeine was able to improve performance, but also placebo, and with similar magnitude. And this increased performance was associated with increased muscle activation in both conditions, placebo and caffeine. But the most interesting finding was we found a reduced brain oxygenation over the prefrontal cortex in both caffeine and placebo conditions. There is no contradiction in observing a reduced brain oxygenation by using caffeine, because caffeine reduces the cerebral blood flow by vasoconstricting the cerebral vascular net. But the interesting finding here was even ingesting placebo, a inert pill without pharmacological effects, the brain oxygenation over the prefrontal cortex reduced too. So indicating that placebo is able to change brain activation, because oxygenation is a measure highly related to activation. So both oxygenation and blood flow here reduced by using caffeine, but also by using placebo. So this is a piece of evidence that placebo changes brain activation over cerebral areas related to reward system. So more recently, we published another paper, and we investigated carbohydrate monitoring's effects in mental fatigue. So this study was designed to answer a different response. It was not a placebo study, but we used a placebo perceived as carbohydrate. So as the last study, as the previous study, we didn't use a clinical trial, a placebo clinical trial. We used, a clinical trial placebo. We used a placebo perceived as carbohydrate, and we submitted the participants to a VO2 max test during 3 conditions: a baseline without intervention, carbohydrate monitoring during the exercise. So the individuals rinsed their mouth immediately before the exercise when they were mentally fatigued before the exercise. Remember, this study was not designed to investigate placebo. And a third condition, that we used a placebo perceived as carbohydrate, and we measured the brain activation over the prefrontal cortex and primary motor cortex by EEG, electroencephalography. And what we found was increased motor performance only with carbohydrate in blue color here. So placebo was ineffective to improve performance. But when we take a look on the brain response, we see that uh, not only carbohydrates, but also placebo were able to increase the brain activation over the prefrontal cortex, this upper panel, as well as in the primary motor cortex, in this lower panel, especially at the end of the test, from 50% of the maximal duration. So even though the performance was not improved with placebo, placebo changed the brain activation as the active substance did. So this is another piece of evidence that placebo can change brain activation, even though some performance results might not be related, uh, likely showing that placebo effects are more complex than we can expected before. And we can also have some piece of evidence from other multidisciplinary studies. So this is a recent study by Codell, and these authors used a TMS, a transmagnetical stimulation, transcranial magnetical stimulation, in a reward paradigm motor task. So the participants had to move a mechanical arm to reach a target, while the researchers measured the accuracy of the selected response. So how was the accuracy in reaching the targets, and the percentage of error in doing this task. And they used TMS to stimulate different brain areas related to reward system. So they used TMS to increase the excitability of the supplementary motor area. Remember, an area related to reward system, and over the prefrontal cortex, the ventral medial area, so another area related to reward response. And as a control, they use the sham. In other words, a stimulus without effect, the placebo. And they used a monetary reward, to keep participants motivated to do this task. So what did they find? What did they find? The result was the TMS over the supplementary motor area, as well as in prefrontal cortex, increase the accuracy of selection response. But this result didn't happen only with TMS, the active treatment. It happened also with sham intervention. So even using a sham intervention or a TMS without effect, a placebo, the accuracy of selection increased too. And the same result was observed in the error. So the change in the error of the selected response was very similar across the conditions. So what these results suggest? That not only the active treatment, as using TMS over different brain areas related to reward and also related to motor command, but also the placebo induce the same results. So this is another piece of evidence that not only the active substance, the active treatment, but also placebo can induce the same result as the active treatment does. So another piece of evidence come from an earlier study by Fiorio. So this study used the TINS paradigm. So they use electrical stimulation to induce a placebo effects. Why? Because the authors informed the participants that TINS would have a beneficial effect in a motor task. So they submit the participants to press a piston with the index finger, and they measure the produced force by pressing the piston. So they had four conditions. A things induced by expectation, or a beneficial things result induced by verbal suggestion. So the authors verbally informed the participants verbally that the things would be a beneficial effect in this motor performance. They had another placebo condition in which they induced the participants' expectation by manipulating the verbal suggestion using a positive verbal suggestion combined with a conditioning procedure. And then they have two controls. So what did they find was the performance increased by the positive suggestion that things would have a beneficial effect. So both placebo conditions being induced by verbal combined with conditioning procedure, being manipulated by verbal suggestion, both conditions had a beneficial effect on motor performance because participants improved the peak force. And both conditions had also a different change in brain activation. So they measured by TMS the amplitude of the signal during the transcranial magnetic stimulation measure over the target muscle, and they found an increased amplitude of the signal when you use the TMS over the motor area, the motor cortex area, when measured over the target muscle. And this increased amplitude in the motor evoked potential was also associated with a decreased silent period or cortical silent period during the transmagnetical stimulation, indicating that both placebos being induced by only verbal suggestion, like pink color, being induced by verbal suggestion combined with conditioning procedure, indicated by red color, changed the response in cerebral and spinal areas related to reward and related to motor control. So this is another piece of evidence that placebo can change brain activation and the stability in spinal cord. So when designing new studies, we should also consider sex as a potential factor in placebo effects, and we should also consider investigating nocebo effects. Why sex might be a factor changing placebo effects and motor performance response? Because estradiol plays an important role in dopamine, GABA, and kappa opioid receptors, thus changing the brain activation, the tissue activation induced by those neurotransmitters. So there are specific brain areas potentially affected by sex. So there are evidence from different fields showing that prefrontal cortex, orbitofrontal cortex, supplementary motor area, um, anterior cingulate cortex, thalamus, posterior cingulate cortex, all of them are areas potentially influenced by sex because estradiol might change the brain activation initiated by those neurotransmitters over these areas. So future studies should also consider investigating potential sex influence over these reward and motor control, motor command areas. But also, future studies should also consider nocebo in placebo designs. Actually, nocebo is the positive effect of placebo. When we have a positive expectation about the future, we can have a placebo effect induced by change in expectation. And the positive is nocebo. So nocebo is expectation about a harmful effect in a treatment or in a manipulation. So there are only a few, actually a very few evidence investigating nocebo and showing that nocebo responses are very complex. So in this study by Corsi a few years ago, they used a motor task very similar to that task used by Scott a few years earlier, and they used a motor task in which the participants had to press the piston with the index finger while the force was measured. And as manipulation, they used a factorial design to see the combination between negative and positive verbal suggestion with positive and negative conditioning procedure. So they used a combination of positive verbal suggestion and positive conditioning procedure, positive verbal suggestion with negative conditioning procedure, negative verbal suggestion combined with positive conditioning procedure, and negative verbal suggestion with negative conditioning procedure. So they used a pain paradigm to change the participant's expectation by using verbal and conditioning procedure. When the expectation was positive, is because the participants expected a relief in pain by verbal suggestion or positive conditioning procedure. The nocebo response was induced by a harmful expectation of a harmful response during the motor task by using negative verbal suggestion and or negative conditioning procedure. So the result was quite complex because when you see the force was improved by both positive verbal suggestion, even when the positive verbal suggestion was combined with negative conditioning procedure, showing that perhaps verbal suggestion has an important role, an important effect in inducing placebo effect, even in the presence of a nocebo manipulation. So if you see the sense of effort during these four conditions, we also see that the verbal suggestion, the positive verbal suggestion, had a higher effect for sense of effort, even when combined with negative conditioning procedure, showing that perhaps the verbal suggestion is a powerful way to induce placebo effects when the nocebo effects is presented too. But during the motor task, they measure the amplitude of the evoked motor potential. So they use the TMS during that motor task to measure the cortical spinal excitability, and they didn't find any effect of verbal suggestion, of positive verbal suggestion on the corticospinal stability, but they found that the conditioning procedure had a higher effect on the corticospinal stability as measured by the motor evoked potential, the amplitude of the motor evoked potential measured by TMS. So these results show that nocebo can have a very complex result. So we should put some studies in advance to better understand the interplay between placebo and nocebo in motor performance scenarios. So most suggestion is that placebos can induce analgesia by conditioning, and performance, and placebo can induce increased performance, can improve performance by suggestion and conditioning. But nocebo is highly affected by verbal suggestion. So verbal suggestion is likely more important to induce nocebo response. And when we are talking about placebo, it depends. If you are using a pain paradigm by suggesting an analgesia response in a placebo intervention, so it's more affected by conditioning, or if you are talking about performance enhancement, because performance can be changed by placebos, by suggestion or conditioning procedure. And future studies should also consider measuring different brain areas in nocebo and placebo paradigms. So there is a earlier study by Scott, and they found that the brain activation in different cortical areas related to reward and motor performance or motor control have different activations if you are using a nocebo paradigm, a nocebo intervention in red, or a placebo intervention in green color here. So future studies should consider measure brain activation in these different paradigms. So we are moving now to the final part of this talk, and I'm gonna show you some final considerations and take home message. So I think the main message of this talk is that we can use the reward system to understand why and how placebos improve motor performance. Why? Because the same areas that play a role in reward responses are play a role also in motor performance response. And both response, reward, and motor performance share the same neural circuitry. So here we have a good model to understand what happens with brain activation in placebo and nocebo scenarios. So we already have some good clues of which brain areas should be included in those studies. So areas basically which in which dopamine, glutamate, and opioid play an important role as a neurochemical signature. So future studies should also consider the influence of other neurosubstrates that we were not included here, such as GABA, because there are a very few evidence that GABA probably plays a role on reward areas. And they should also include different placebo paradigms to understand placebo response on motor performance, such as analgesia, monetary, and supplements paradigms, having in mind that these different paradigms might induce different placebo response, because placebo response might be different between analgesia interventions, monetary interventions, and supplements. So I would like to finish my talk giving some acknowledgements. I'm very thankful to FAPESP Brazil and to CNPq Brazil for all the support, for all the funding to conduce my placebo studies. I'm also very thankful to University of São Paulo, my university in Brazil. And I would like to give a special acknowledgement and thankful to my students and research group. Without them, nothing would be possible. So thanks so much for everyone, and be in touch. So find me in the social media, and my mail is here. Just let me know, and then we can share some ideas about placebo. Thank you very much. See you soon.